morning, everybody, and welcome back to the Chamber Vibes podcast. No, Kayla is not here this morning. You've only got me, Foster Garrett, and we're here with a very special guest who I'll introduce in a second once I get through our many, many events. As you know, the Chamber is always putting on a lot of great things. We love to give great services to our members and the community. So I'm just going to touch on a couple of the events that we have coming up. It's a very busy spring season. So if you go on our website, which is bedfordareachamber.com, you will find all of the events laid out right there for you in a much more manageable sense than what I'm about to spiel through. So very first thing on our roster, Leadership Bedford. That is our leadership series. It's a 6-month program, which is really amazing, and we've been able to offer it to the community for 26 years. Registration is actually closing this Friday, March 24th for that. Like I said, it's a great program. It's fantastic for people who show a disposition for professional development. We'll do panel discussions with local governmental and business leaders. We're going to do industry tours. There's going to be a lot of team building and great things. Monique Minnick is our lead facilitator for that, and she is an amazing partner for the Chamber and has also done some other leadership stuff for us. And she's just a really great person, a really great teacher. And yeah, Leadership Bedford is great. So you should definitely check it out. Like I said, registration closes on March 24th, which is this Friday. So don't miss out on that. The second thing we have coming up is our 10th annual job fair. This is something that I'm personally really excited for. I think it's going to be a great hiring and career development event for the community. It's happening on April 6th from 10 a.m. to 2 p.m. at the Forest Public Library. Last year we had around 30 exhibitors representing businesses all over our region, and this year we hope to have even more. It's free for job seekers, and we'll have a variety of full-time, part-time, seasonal jobs, internships, what have you. In addition to being open to the public, the Chamber is working with Bedford County Public Schools to bring high school seniors to the event, and we're happy to be offering free workshops, free headshots, and giveaways like always. So yeah, it's going to be really awesome. Radio 434 and the Mike Show will be in attendance to conduct man-on-street interviews. There's a lot of great things happening at this event. So if you're a business and you are hiring or you just want to make professional connections in the community, the last day to register for this event is March 27th, which is next Monday. So get on it. The next thing we have coming up, yes, like I said, a lot of things. Our legislative wrap-up is on April 18th. This is like a business over breakfast type event. It'll be happening after the 2023 General Assembly session. So legislators for our local community will be there. Some of the confirmed people that we have that will be in attendance are Delegate Wendell Walker, State Senator Steve Newman, and Matt Hall, who's the community liaison for the Office of the Attorney General. So all great people, come on out. This is at Cedar Oaks Farm on April 18th. So go ahead and register. It's open on our site. And the last thing that we have coming up that's a really big event is our golf outing, which is on May 11th. This year it'll be at London Downs. And we're really excited for that as well. It's a little bit far off, but go ahead and get your team. It's teams of 4, and all of the proceeds go to the Chamber's educational initiatives, which is awesome. But yes, those are all the events that I have for all of you to partake in. We also have some networking events this Thursday. We have a live at 5 at Clater Nature Center at the Cloverleaf Farmhouse. And we have a noon ribbon cutting for Robin Lee at from Legacy Realty and Development. That'll be at the Villas at Oakwood Clubhouse. Yes, I snuck in those networking events right at the end, but those are this Thursday, March 23rd, tomorrow. So make sure you come out. It'll be a great showing. I'm really looking forward to it. So yes, for real this time, welcome Jen Webb, the Chief Executive Officer for the Free Clinic of Central Virginia.
Hello.
Good morning.
Hi, good morning.
We're so happy to have you here with us.
Thank you for having me.
Yeah. So before we get into it, can you give us a little bit of background about yourself and your business?
Yes. So I am a emergency room nurse that Started nursing about 15 years ago,
Wow.
and while spending time in the emergency room, I really learned about the inadequacies
Mhm.
of healthcare delivery, and I became very passionate about increasing access to healthcare. So, from that, I went into all different paths, but the one that has really grabbed me and held on to me has been working with the Free Clinic of Central Virginia, and I've been involved with that agency since 2014.
Wow.
Yes, yes,
So almost 10 years.
yes. And we are a local nonprofit
Mhm.
that is, specialized in helping people who need access to
Mhm.
healthcare. So I'm sure you have more questions about that. So I want to jump into your questions.
Okay. Um, so yeah, can you tell us a little bit about what it means to be a free clinic and who exactly you offer services to?
Yes. So we were formed, the Free Clinic of Central Virginia started in 1987. So we've
Wow.
been around a long
Yeah.
time. A group of passionate community members came together and they were really frustrated with seeing so many people having
Mm.
lack of access. So they started in a church basement in Lynchburg, and then slowly started to grow. And we have been supported by our community all
Mhm.
along. So
Yeah.
we were able to purchase a building in downtown Lynchburg, and that became our primary location.
Mhm.
It's on Main Street. And so folks come there that either we call them underserved
Gotcha.
because I think there are points in everyone's life where they might have needs that aren't being met.
Mhm.
So you might have insurance, but you can't get in to be seen for, some type of condition, or you don't have insurance because you lost your job, but hopefully you're going to have insurance in a couple months,
Mhm.
or you're just unable to find employment and you need healthcare. We really believe that everyone should have equal access to healthcare.
Mhm.
So we work really hard towards, increasing access to whatever people might need.
Yeah, that's amazing.
Mhm.
That's a very
Noble
valuable.
calls.
Yeah, it's a very noble cause.
Yes.
I'm sure people say that all the time, but I mean, it's great to do work with people who need it
Yes.
and to be able to offer them services that, aren't obstructed and,
Correct.
are community based.
Correct. Yes.
Yeah. So, what type of services do you normally offer?
So we pretty much have access to get people whatever it is that they might need.
Awesome.
Yes.
Awesome.
So, but our main services are medical, dental, and behavioral health.
Hmm.
But we're able to, through referral networks and connections with different community resources, we're able to get, so if we don't offer something within the four walls of our
Hmm.
clinic, we can refer folks and find them somewhere to be able to seek that care.
Gotcha.
Here in Bedford, we do not have dental,
Okay.
but we do have connections with Johnson's Health here
Hmm.
to help get into
Yeah.
dental, and we can also see folks from Bedford in our Lynchburg location for
Mhm.
dental.
Awesome. So you mentioned that you have multiple locations. Where are all of these buildings?
So we are located downtown Lynchburg, like I
Hmm.
said, 1016 Main Street. And then we have a unique relationship with Community Access Network, which is
Hmm.
a look-alike federally qualified healthcare center. I know those are a lot of big words and kind of overwhelming, but basically, federally qualified healthcare centers are like Johnson's and Community
Yeah.
Access Network, and they get money from the federal government. Whereas free clinics operate on a very small portion of funds from the state, but the
Gotcha.
rest of our operations come from individual donors
Hmm.
as well as through grants and different community resources. So within Community Access Network in Lynchburg, we actually operate out of that organization. And the benefit to that is they have walk in hours, which is not something that we do in any of our other clinics.
Okay.
So you're able to walk in there and be seen. And that's helpful because some people, it's not always easy to make an
Hmm.
appointment. And if
Yeah.
you're sick and have an acute need, that's helpful. And then we're here in Bedford, and we are on Center Street. We've been, I think, 104 is the address, and we've been there for about 2 years now. And we are currently working 1 day a week
Gotcha.
out of that location. Bedford reminds me of when Lynchburg started.
Mhm.
So, you know, traditionally, free clinics are operated by
Mhm.
volunteers. And so
Yes.
we're in the early stages of finding local community members that want to volunteer and be part of the organization.
Mhm.
And so, you know, that's kind of something that grows as the community
Yes,
becomes
yeah.
more involved.
Well, I think, as you said, it's a noble cause. So
Yes.
I think you won't have any issues finding
Hmm.
volunteers. And I truly encourage everybody to get involved. Everybody that's listening, all our great invisible listeners. Um, so do you have any? I see here that one of your the things that we wanted to talk about was your history in Bedford. Uh,
Yes. So
yeah.
we took over the Bedford Christian Clinic that was in
Okay.
the building that
Yeah.
we're currently located. So they were in a place where I think they had just reached a point where they weren't sure how they were going to continue to
Mm-hmm.
maintain operations. We were able to get a grant through the Bedford Community Foundation with
Oh,
Denny
cool.
and that group to be able to pay rent there for the first year. And, through that partnership, we've been able to maintain staying here.
Mm-hmm.
Um, I grew up in Amherst,
Oh,
Virginia.
cool. Yeah.
So you either say Amherst or Amherst. And I'm from there, so I say Amherst. And Bedford reminds me a lot of my
Yeah.
hometown. I love coming here. I mean, even just being in this studio, like there's all these
Yeah.
little diamonds in the rough and, little places that you would just never expect. And, the community is a tight knit one though. There's
It
no
is.
doubt. So, building trust and getting people to be involved. We're
Mhm.
trying to make some shifts in things in response to what the community might need.
Mhm.
We're very open to that, but we definitely need the community to back us up in order to stay here.
Yeah.
Our big term goals would be, or long term goals would be to have the same level of operations that we
Mhm.
have in Lynchburg.
Yeah.
But we've got to build up to that. But our history here is very new. And we're excited to be here, and we've gotten great response from the
Mhm.
people who've come. And the Medicaid situation where the access to insurance really increased during COVID.
Mhm.
It's called Medicaid expansion. I'm sure people heard those words. Well, now the new term is Medicaid unwinding. So come July, they will start the process of pulling back some of those benefits. So a lot of people that were able to get Medicaid in the last few years will actually
Mhm.
lose their coverage. So we will be a place that people can go and get access to
Yes.
healthcare, medications, and all of that within Bedford.
And I'm sure you'll also have a surge of new clients who will be coming in.
Yes.
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 Yes. And
So,
we're ready for
oh
that.
yeah. It's always good to be busy.
Mm-hmm.
Um so yeah, what is some I know we have so much noise happening outside of
I
the
mean,
studio
honestly, I
right
feel
now.
like we're surrounded by
We
a
are.
racetrack. Like we're in the middle of one. I'm not sure. It's amazing.
Woody just keeps shaking his head.
I mean, honestly, like in my head, what is going on outside is probably very different than what's actually
Yeah.
going on outside.
I kind of like the mystery of it.
I know. I'm envisioning some crazy person going up and down the railroad tracks is kind of what I'm at right now,
I think
blowing their horn.
somebody really has to get to work and they really want the train to go by them faster.
Amazing.
Not to cut out because of the noise. But
Yes. Yes.
um so sorry, still giggling over that.
It's all right. I think, just continuing with those lines, like, free clinics cannot exist without community support.
Yeah.
And I think that Bedford is the perfect community for
Mhm.
that. And I think that, we recognize that sometimes when people don't know what something is or
Mhm.
who is running it, or you've never met, those people or whatever, that people can be hesitant. But the thing that people really have to remember about a free clinic in particular is the people that are there, most 90% of them are
Yeah.
volunteers. So if you really think about the level of service that you get from a volunteer, somebody who's choosing, they're not there for community service. We
Mhm.
don't do that. They're there because they want to help other people. So that love and that respect of human beings is huge. I mean, people
Yes.
have so many things on their plate and so much going on in their lives, and people that choose to give and give back with their time, it's huge. Now, don't get me wrong. I would love for anyone in Bedford to give me money because we need money to operate. But the gift of time and the opportunity to help other people, those folks are, it's just a different type of treatment. I mean, when
Mhm.
you go to a doctor's office, I'm not saying that people don't get good care at doctor's offices, but I think there's a different level when you've got volunteers
Mhm.
who are choosing to be there because they want to give back,
Yes.
not because they're there to make a paycheck. It's just different, and I think you feel that when you come to a free clinic. It's a different environment, and
Mm.
I love it.
I think that there's a lot of great organizations that start out very, very small in
Mhm.
Bedford and have grown. I'm thinking of the Bedford Community Christmas Station,
Mhm.
which is just an amazing
Yes.
organization. One of our staff members, Lily Coleman, is a volunteer there, and she always loves to talk about it.
Mm.
And it's something that started really small as
Mhm.
just somebody seeing issues in the community or with the established services by the state and wanting to do something that was better for the community, a little bit easier for people.
Yes.
And it's just grown and grown and grown.
Yeah.
So I hope that is something that happens for
I
y'all.
do too. I mean,
Yeah.
I think, you've hit the nail on the head there. I mean, when the why behind something. I
Hmm.
mean, there's a lot of that kind of talk right now, like especially post COVID, people are like, why am I working? What am
Yeah.
I giving? What am I doing? Because we're all burnt out and we're all exhausted. But when the why behind something has such significant meaning and helps other people, it gives people purpose.
Hmm.
And, I've seen it firsthand. I mean, you could make all the money in the world, but if your why isn't there to back it up, you're not as happy.
No.
And, it's that intrinsic motivation. And I think again that's what you see at a free clinic. You see people that are there for a different kind of why, and it's impressive. And I love being part of it.
Awesome. It's people who want to help people for the sake of helping people.
Correct,
Yeah.
correct. Not for the dollar.
Yeah.
Again, I will take your dollars.
So will I.
Yes. But that is, when we seek out money, the difference between mm, a free clinic or my organization and another, like when I am seeking funds at the end of the year, I don't care if I'm actually negative $1 on my balance sheet. I care more about the fact that I've been able to supply X amount of dentures
Yeah.
or, this many vaccinations or given, this many women the opportunity to have a mammogram and all of that. That is far bigger than any monetary goal that we could possibly have. So, I think, yes, we need funds, but what we need funds for is not to make my salary
Hmm.
bigger. It's to offer more services to people who don't have access to them.
Awesome.
Yes.
Well, this has been a great conversation. Do you have anything else that you'd like to add?
No, I mean, I think, again, stop by. We're there on
Mhm.
Wednesdays. We're looking to hopefully add some more days. We've talked about being available when the Otter Bus is
Mhm.
running. So we're trying to figure those things out. If you're interested in volunteering, you can visit our website. It's free clinic, freeclinicva.org. And also you can send an inquiry to be a
Mhm.
patient. Just reach out to us.
Yeah.
You're not gonna people aren't gonna be annoyed is all I can say. We will be very excited to see you.
And what is the best way for people to get in contact with you if they want to volunteer?
I think the website
The
for sure.
website.
Yeah.
Okay.
We there's a link on the website that says become a volunteer or either
Mhm.
volunteer. And if you go on that and fill out the paperwork, we have a volunteer coordinator. Her name is
Okay.
Julie. She's amazing. She will reach out. If you are a medical provider and you volunteer with us, we offer insurance through the state of
Mhm.
Virginia that will cover you for anything. And if you just, I mean, we will take volunteers from people who are interested in, filing to answering phones
Mhm.
to, being an actual physician or, cleaning, sorting, organizing. Like, if you don't feel like you have a skill to offer, don't think that. We will find something for you to do. We love volunteers and we love figuring out places to put them. So don't feel like you need a specific skill set to volunteer because that's not the case.
Yes. Well,
Okay.
awesome. Well,
Yes.
thank you so much for coming.
Thank you. I appreciate it.
Yeah.
Can't wait to go outside and see what's going on.
Right? Well, hopefully the train has passed by
Yes.
now.
Yes.
Well, thank you again for
Thank
joining us.
you. I
And
appreciate it.
if you need to contact Jen Webb or if you want to find more about the Free Clinic of Central Virginia, visit their website.
Mhm.
And if you have any questions for the Chamber, feel free to visit our website, bedfordariachamber.com, or call our office at 540-586-9401. And thank you all for listening, and look out for the next Chamber Vibes podcast.